goes on at the VA and NIH and the research that is absolutely indispensable in providing the highest quality health care for veterans in our nation. And Donald Trump is turning our entire healthcare system into one big emergency room. We already have a sick care system in our country. We have to turn it into a healthcare system, but we cannot do that with massive cuts to the healthcare system in our nation. It is all interrelated. Cuts to the VA budget, a $900 billion cut to Medicaid, a $500 billion cut to Medicare, a $300 billion cut to the Affordable Care Act. All of that is part of the larger healthcare environment within which Massachusetts and the rest of the country will be operating. So we just have to make sure that we fight to avoid the worst case scenario unfolding in our country, because it's going to cascade down and affect the healthcare of the most vulnerable. And that affects the poor, the sick, the elderly, and the veteran community, which deserves the best that we can provide to them, not what is about to unfold in our country. So we're blessed to have Secretary Santiago working as our secretary in Massachusetts. He is the best of the best, and he helps to ensure that Massachusetts is at the cutting edge in identifying and trying to deal with the problems that veterans in our state are confronted with. But regardless of the Trump administration attacks on veteran care, the commitment of our local institutions, led by Secretary Santiago and Governor Healy, and the dedicated public servants here in Massachusetts will remain unshakable in their commitment to provide the health care which every veteran deserves. But from the challenging days of the COVID-19 pandemic to the current instability from veterans across, facing veterans across the country, today Massachusetts has channeled vast investment into our veterans, from Massachusetts soldiers' homes to organizations across the Commonwealth that provide direct veteran services. And that investment is not just an opportunity, but it is an obligation, and we must make the VA more and more and more customer-friendly to the vets that served our nation. We just can't walk away from that responsibility. So I am absolutely committed to returning to Washington with the lessons which I have learned from this incredible roundtable today. These people dedicate their lives to helping our veterans. We were served by those veterans, and we must serve them and their families with all of the needed medical care which they are entitled to, which they earn. So I'd love if you, Mr. Secretary, could say a couple of words.
Sure. Well, I just want to thank you, Senator, for being a champion when it comes to veteran issues. Whether it's your staff or yourself, getting involved, engaging. Today you convened a group of veteran service providers, research, to listen and learn more about our experience and the headwinds that we face given the federal government. We are proud here in the Commonwealth of Massachusetts of what we've been able to accomplish the last couple of years under the leadership and guidance of Governor Healy, Lieutenant Governor Driscoll. We've been able to transform the work at the veteran home, pass the most comprehensive state legislation when it comes to veterans, and really put us on the pathway to ending veteran homelessness. But we can't do this alone. It requires partnership and engagement with our providers on the front lines, with our federal delegation. I just want to thank you for convening us and leading on this important endeavor.
No, thank you. And so my bottom line is a vision without funding is an hallucination. We need the funding for veterans. We need the funding for their health care. We need funding for their families. They earned it. We owe them. We cannot allow for these cuts to continue. By September 30th, 30,000 positions at the VA will have been eliminated. That is just unacceptable. When a veteran has a need for health care, they shouldn't have to wait 6 months, 8 months, 10 months to get access to the care which they deserve. We have to make sure that we make the VA questions from anybody?
Just want to change gears a little bit, talking about the Trump administration, tariffs are in effect right now, making costs much higher for Americans, including veterans, when we think about it. Just your thoughts on, that and what the administration's doing to prices for everyday people.
Well, prices at the kitchen table are going to go up. The price for health care is going to go up as Medicaid cuts, Affordable Care Act cuts go through our system. We're going to see higher and higher health care premiums for families all across our country. Electricity rates are going to skyrocket. They're already increasing 3 times the rate of inflation in our nation as the president exports 15% of our natural gas while killing wind and solar and battery storage technologies. Who's going to pay the price? It's going to be consumers at their kitchen table. And this tariff regime is going to be impacting families from the price of coffee that they have to pay, to clothing, to any other item which they have to use. It is now clear that upwards of $2,500 additional dollars will have to be spent by consumers, families across this country over the next year. So whether it be healthcare, electricity, or the price of goods, there is going to be a dramatic increase in prices for ordinary families in our country, and all of it is as a part of this chaotic and corrupt Trump administration and the policies which they are seeking to implement.
And some of those folks that have served the country are now walking around the streets of Washington, D.C. today. Your thoughts on that situation?
I'm sorry?
The National Guard being militarized, being used down in the nation's capital, pretty much on a police beat.
Well, when the insurrectionists were attacking the Capitol on the day that we were counting the Electoral College ballots, Donald Trump would not call out the National Guard. Now, he is declaring an emergency where there is no emergency in the District of Columbia. When the troops were needed, he didn't send them. When the troops are not needed, he is sending them, and it's all a distraction away from his avoidance of releasing the Epstein files. That's what he's hiding, and that's what he's trying to distract the American public from focusing on.